It's one of the leading work-related injuries resulting in severe pain, medication, and even surgery. Let me tell you, there is a better answer. Do you know which common work-related injury I'm talking about? To find out more and see how chiropractic can help, let us join Dr. Ashley Herfindahl. Dr. Ashley?
Did you know that the second leading cause of work absence is actually carpal tunnel syndrome? So today what I'd like to talk about is carpal tunnel syndrome and what it is and what it actually means to you. The first thing we want to talk about what carpal tunnel syndrome is. So first of all, we all have a carpal tunnel. So let's look at my hand here for a moment. What we have here is we have 8 carpal bones, and on top of, as far as that carpal bones, we have a transverse carpal ligament. And we have a little tunnel that comes through in here. Now what goes through that carpal tunnel is actually 9 tendons, and we also have 1 nerve. Now, the interesting thing about the wrist is, guess what? We have 19 muscles in the wrist, allowing us to move all over the place. Now, when we're looking at carpal tunnel syndrome is actually the median nerve. That's the nerve that comes through here, and that can be irritated. And when that nerve becomes irritated, we can get tingling sensations in our hands. Primarily these top 3 can actually be irritated. We can also get numbness sensation, tingling, pain, excruciating pain, and also we can actually get as far as weakness. That's why you may grab something in your hands or as far as weak. Those are all signs of possibilities as far as carpal tunnel syndrome. But the most important thing is that median nerve can be entrapped in several areas. And as a chiropractor, that we actually take a look at all those areas. Now, first off, that median nerve actually can become branched off from your neck. As you can see here, this is the normal spine. And as actually it's composed of these individual vertebrae separated by this guy called the disc. Then we have the spinal cord in the back, so that life force energy from the brain down your spinal cord to those nerves. And that spine can be actually misaligned, and we get that subluxation, that misalignment in that vertebrae. Now when that occurs, it can actually entrap the median nerve and can produce symptoms in the hand. Not necessarily the neck, but you can just have symptoms in your hand, but it's coming from the neck. And that subluxation is what a chiropractor actually will look at. They'll evaluate you. Take a look at your neck first. The next thing is those nerves will branch out, kind of like fingers, and we call that the brachial plexus. And those nerves will branch out down your arm, and they can be entrapped and as far as in the shoulder. That median nerve can be interfered in that area to cause those symptoms in the hand. It can be interfered in actually in the elbow. And of course, number 1 is as far as in the wrist, because that's what we're talking about carpal tunnel syndrome is. Now, the first thing we want to talk about carpal tunnel is, again, that nerve can be impinged in the neck, shoulder, elbow, or even wrist. And as a chiropractor, we take a look at them all and see exactly where it's actually being interfered with. Now, a nice little test that chiropractors like to perform to see whether or not you are having carpal tunnel syndrome, it's called the Failings test. And what we do is we take our hands, we put them upside down, and we actually push them together. And if we're actually pushing them together and we're getting symptoms of carpal tunnel syndrome, that's a possibility where there's entrapment at the wrist. Now, the big thing with carpal tunnel is, and I would like to talk to you about, is in terms of prevention, preventative ways to prevent carpal tunnel. Or number 1 is, how do we get carpal tunnel? Because that's the big thing is, patients come to see me, come to see your chiropractor, and like, I have carpal tunnel syndrome, what happened? Well, a couple things can cause it. First of all, trauma can happen. We can, as far as we walking around, we as far as falling and outstretched as far as hand, and actually can reproduce as far as carpal tunnel syndrome. Another way you can have carpal tunnel syndrome is arthritis, that nasty word arthritis, and that really means a problem's been there for a long, long time, where the bones, actually in the carpal bones, they start to promote bone growth, because that actually can entrap that median nerve and cause irritation of that median nerve. Another one is, and this is the big classic one, we're talking about work injuries. You know, this number 2 is as far as carpal tunnel. Only number 1 would be lower back pain, is actually at a keyboard. Sitting at a keyboard and looking at a keyboard, typing away. And that's a big one that can cause carpal tunnel. Or else, actually in the construction industry, do you know that construction workers can actually have carpal tunnel? Guess how they do that? It's usually the ones who use a jackhammer. That vibration going on here can actually cause carpal tunnel. Now, also carpal tunnel can be also due to excess fluid. Guess how we get excess fluid? Number 1 is if you're overweight. Obesity can actually cause entrapment on as far as in that median nerve. Now, also too, those as far as diabetics can actually have that. Another one is as far as we're actually finding out with women with hormonal change, usually menopausal women with that extra fluid. Or guess what? Those young ladies out there, they're pregnant. Pregnant women can actually get as far as carpal tunnel-like syndromes because as far as that fluid intake. So those are the things to be aware of. Now, the most important thing is, what do you do about it? Well, number one is, what are the solutions? Say you have the carpal tunnel. First off, got to get checked by your chiropractor. Rule out any problems in your neck, shoulder, elbow, or wrist. The last thing you want to put in your mind is surgery. Surgery, they only look at the wrist. I actually had a patient came to see me. They had both carpal tunnel-like syndromes as far as were going on. They had the surgery on left and right hand. Guess what? Left hand was good, right hand wasn't. Guess why? Because they went to a hand surgeon, they did the surgery, great surgery, but guess what? Didn't solve the problem because the problem in this case was in that actual neck. So that's the most important thing is, as a chiropractor, we will look at all those areas, the neck, the shoulder, the elbow, and the wrist to see whether or not you have carpal tunnel syndrome and where it's actually coming from. Now, other treatments as far as chiropractor will do, will actually adjust the wrist. They may adjust the elbow or the shoulder. Also, nutritionally to do is important you can take is as far as vitamin B6, vitamin C. Either complex of vitamin Bs have been proven to helpful. And the most important thing to do prevention-wise is, guess what? Ergonomics. Making sure you have a good, proper tray. Also, too, proper tray for your hands and your wrists, but most important, your neck. Because have you seen those people out there, carpal tunnel-like syndromes, heads being forward, entrapment at the wrist can cause that. So if you have any more questions, feel free to ask your chiropractor. Also, if you know anyone, friends or family or coworkers that have carpal tunnel-like syndromes, please refer them to your chiropractor. I'm sure they're going to be able to help them too.